When it comes to diagnosis, presence of schistosomal eggs in stool for all species, or urine for S. hematobium, under light microscopy is the most reliable diagnostic test. Moreover, direct visualization of the eggs allows for identification of the species causing infection through morphologic differences in the spines and the sizes of the eggs. However, the sensitivity of this method is limited in early infection and when the intensity of infection is low. Colonoscopy and cystoscopy have greater sensitivity but are more invasive when compared to microscopy. Therefore, these methods are reserved for cases when the diagnosis is suspected but microscopy is negative. Demonstration of eggs within the tissues on biopsy of the rectum, intestines, or bladder would be diagnostic of schistosomiasis. In the lower image, S. mansoni is visualized in the intestinal wall on colonoscopy. Serologic testing is both sensitive, greater than 90%, and specific, greater than 95%, but cannot be used to distinguish between prior and active infection. Therefore, serologic testing is only useful for ruling in schistosomiasis in travelers who have had no prior exposures to the parasite, and for ruling out schistosomiasis in endemic populations. Of note, the sensitivity and specificity is limited in early infection given that seroconversion generally does not occur for 4 to 8 weeks. Lastly, radiographic imaging is helpful in established disease and can identify complications of chronic infection. For example, radiographic imaging is useful in cases of S. hematobium with urinary tract involvement to visualize granulomas within the bladder wall, bladder cancer, and hydronephrosis. It can also assist in cases of S. mansoni and S. japonicum with liver involvement to visualize fibrosis, hepatosplenomegaly, and ascites. A radiograph of the bladder shows curvilinear calcification in the bladder wall, indicated by the arrowheads, with extension to the distal left ureter, indicated by the arrows, consistent with an abundance of calcified eggs typically seen in chronic infection.